accept that, that would be great. I am now going to start sharing my screen and want to confirm that folks are able to see the screen.
Yes.
Wonderful. Okay. So just to orient everyone to the way this presentation is compiled, on the left side of your screen, you will see the slide information in English, and on the right side of the screen, you will see it in Spanish. This is to make sure that these materials are optimally accessible for anyone who would like to participate today.
Okay.
With that, I'm going to get us started. I'm going to request that folks please put themselves on mute. There will absolutely be an opportunity for questions, but we want to get through and sharing the basic information to get us started. Good afternoon, everybody. My name is Alina Vasquez, and I am with Human Services Research Institute. We are the nonprofit consulting organization that works alongside the Department of Health and Welfare with their ongoing work to support the completion of the KW settlement agreement, which will bring a new assessment tool and a new way of determining budgets for adults in the DD program in the state of Idaho. Today's presentation, which we will also be completing tomorrow as well with an evening session, and it will be the same material, is specifically focused on providing an update on the work to date to obtain and identify a new tool for assessing adults with intellectual and developmental disabilities in the state of Idaho. So with that, I will get us started. So again, our agenda for the day, so we want to start with just a quick introduction to the team at HSRI, since we will be working alongside the department and we'll be meeting with all of you on an ongoing basis over the next few years as we work our way through this project. Give you a little background on the project as a whole, walk you through the process that we have completed for choosing an assessment, and then relay the recommendation that has been put forward to the department from self-advocates and family advocates for the new tool to be used for the program. We'll then conclude the session with next steps, and we'll absolutely have an opportunity for questions today. So to get us started, just meeting our team. I see someone noting that there isn't audio. Other folks are hearing audio, correct? So that may just be an issue on one person's side. Okay, perfect. Just wanted to confirm. All right, getting us started, let's meet the team at HSRI. So one thing to know about HSRI, which again is Human Services Research Institute, is that we are a nonprofit consulting company that works exclusively with state governments and the federal government to help try and improve service systems for people with disabilities and older adults. We have a core belief system that all people and their families have the right to live, love, work, play, and pursue their life aspirations in their community. And the work that we do to support states in their programs for people with disabilities and older adults is always value aligned with that core mission of our work. We have been in existence for just about 50 years. Our 50th anniversary will be in 2026. And our work has always been about doing research and doing consultation to help improve services and supports for people across the United States and abroad. Our team at HSRI consists of a number of individuals who will be supporting the department through this effort. As I already noted, my name is Alina, and I am a co-director of the Systems Redesign Collective at HSRI, and I lead our work. We have two amazing data analysts and methodologists, Colleen Kidney and Virginia Juarez, who will be responsible for helping to build the new budget framework. We also have a series of policy analysts, including Karen Westbrook, Jade Presnell, and Nicole LeBlanc, who will also be working closely with the department to make sure that all of the associated policy changes that will be necessary to move into a new budget system are appropriately
I
completed.
appreciate that, but I have a nasty bug right now.
We also have, and please be sure you're on mute as we're doing this presentation, folks. We also have a project coordinator who works on our team, Heather Young, who makes sure that we're able to connect with folks and is really specifically focused on helping to ensure that we have adequate supports for our families and self-advocate members who are helping to effectuate this change. So one thing you should know about HSRI's values are around HSRI's values around communication and engagement. I note this because we will be coming to you at set intervals throughout the development of this process and the process of developing a new budget tool for the state of Idaho to share information with individuals who use services, their family members, providers, case managers, and other interested parties. We believe that it is absolutely essential that you obtain this information on a regular basis, that you are getting information as it is available, and that we also have ample opportunities to get information from each of you as we are working to help the state of Idaho develop this new system of determining budgets. Our values around engagement include making sure that communication is as inclusive as possible. As you can see, our materials are available in English and Spanish. We work to use plain language wherever feasible, and we'll be making plain language versions of material as is possible, and want to make sure that people across the state can access this information. We also believe very strongly in transparency. It is one of our core elements at HSRI, and the new budget tool that we are working to develop will be absolutely based on a transparent system where people know how they got to the budget they got, what was the information that was used to determine that budget, and then how they can work with the state to use those dollars to get their needs met. With work such as this, oftentimes there are constraints that are outside of our control. This is something that we note at HSRI and we talk about very frankly with our partners at the department. We want to always be honest about what elements we can or cannot control, what elements may be possible for us to impact or affect, and those elements that may not be. When it comes to the new budget tool or changes to the adult DD waiver, there may be some changes that we hear from all of you that you would like to see happen that are not possible. This could be because of state regulation limitations, this could be because of budget limitations, or it could be because of the rules put forward by the federal government around these waivers, as waivers are an agreement and a partnership between the federal government and the state of Idaho when it comes to offering services. We will always be as honest as possible in letting you know when there are things that you may want to have happen that are not possible or are not within our scope, so that you really are clear on what we are able to impact and then where there may be other areas that you would want to engage in conversation or advocacy to get things adjusted. Partnership is the final and key element of our values when it comes to communication and engagement. We want ample opportunities to work alongside all of you and to hear from you and work very closely with the department. This presentation is being presented by HSRI because we are helping the department with this work, but there are a number of department staff who are on the line today and who are very interested in hearing your feedback about where we are in the process so far. Now that we've gotten some of that background out of the way, let's actually talk about this project and where we're going next when it comes to selecting the new tool for the state of Idaho. So since 2016, our team at HSRI has worked closely with the Department of Health and Welfare. This work has always been focused on creating a new way to determine budgets for adults with intellectual and developmental disabilities. That is because of the KW settlement agreement, which was put in place over 10 years ago. Initially, when we did this work, we worked closely with the department to build a new budget tool using this supports intensity scale, adult or SIS-A. This was the tool that was selected by the department to move forward, and we built the entire structure for new budgets using that tool. We drafted Medicaid waiver amendments to allow for that to be approved by the federal government right as COVID hit. As a result of that, things were put on pause. And at about the same time, we found out that the individuals who own the CIS-A, the AAIDD, were not going to be willing to allow for the level of transparency with regard to the training and the information that assessors receive about how to complete the assessment to meet the expectations of the KW settlement agreement. When that was discovered, it became necessary for us to identify a new tool to move forward with developing a new budget for the state of Idaho and the adult DD program. For that reason, we had to go back to the drawing board and start over with a new tool selection process, which we have been working closely with the department to do over the last year. So just so everyone is really clear about why an assessment is such a key part of the service and supports that folks receive through the Adult DD program, is that each year someone starts by getting an assessment. That assessment will then determine the budget that they have available to design and develop their individual support plan. Once a person's plan has been fully developed, they then will begin receiving services over the course of the year. If they need changes to their supports or services, or their needs significantly change during that year, they can absolutely make changes to that plan and to the services they receive. And if no changes are needed, they will begin the process again, with a new assessment at the beginning of their next plan year. For this reason, the assessment is a key step in identifying and getting to the budget. But what really determines the services and supports that people have access to in the state is the individual planning process. The system is intended to be person-centered, and services should be based on, yes, assess need, but also the identified supports that will best meet those needs from the individual and their support team. So what do we think makes a good assessment? One, an assessment needs to be respectful. We've heard loud and clear from many self-advocates that the assessment that's being used today is not truly respectful to many individuals with intellectual and developmental disabilities. We also need an assessment that asks the right questions, that gives us the information we need to understand what supports someone needs. A good assessment must be accurate and consistent. In order to use an assessment to determine budgets, it must be able to be fair and assess individuals in the same way over time and across different individual assessors. We also must have an assessment that meets the needs of the people who will use it. Assessments can be used for a variety of different processes and different purposes. For our purposes, we need an assessment that helps us understand relative support need so that we can then support the state of Idaho to develop budgets to make services available for adults with intellectual and developmental disabilities. So here's a couple of key reminders before we really dig into the meat of the presentation today. The assessment is just one piece of the puzzle, and it is an important piece, but it is the first in many steps along the way. It will help to determine the budget, but we also will need to spend time thinking about the services that are available, known as the service array, the rates or the amount that people are paid to provide such services, how the planning process works and unfolds, and not only what the assessment itself is, but how the actual process of getting an assessment is experienced by the person. A tool may look just fine on paper, but what you experience can sometimes be very problematic if there isn't the right kind of supports and scaffolding around the assessment itself. And as I already stated, and I just want to reiterate, that the process of planning for your services and supports is going to remain being individualized and person-centered, even as we move to a new assessment of support need. So now let's dig into the process for choosing an assessment that has been completed thus far. And let me see here. I see some notes that people are having some trouble seeing the screen, so I'm hoping that's going to help. And yes, the slides will be made available on the department website, and a recording will also be made available on the department website. It does take a little bit of time to get through all of the approval processes to get things onto that official site, so please bear with us. They will be forthcoming. So how did we support the state in trying to get to a new assessment? Well, this was our second attempt to do this, and we got all the way to the end before we found out that there was going to be a limitation that caused our work to not work out as we intended. For that reason, we decided to go all the way back to the drawing board and looked across all of the waivers that serve adults with disabilities across the United States and asked what assessment tools are being used right now in each of those waivers to understand people's needs. We did a national scan and found 47 different assessments that are currently being used across the country to assess the needs of adults with intellectual and developmental disabilities. We then identified a number of pre-selection criteria, a number of must-haves for what we needed an assessment to do in the state of Idaho. From that process, we reviewed each of those 47 assessments to see if they met those pre-selection criteria. Only 6 of the 47 assessments met the initial set of criteria, and so, or at least seemed to meet that criteria. And so we then narrowed the scope from 47 down to 6. We wanted to be very, very sure that the assessment that was selected was really going to work this time. We were not interested in going for a round 3. And so in addition to the national scan, we also conducted in-depth research and interviews with the owners and developers of these 6 assessment tools, as well as the states that are currently using the 6 tools that remained in contention. Through that process, we identified that of the 6 tools that appeared to meet our criteria, in fact, only 3 were going to meet the needs of Idaho moving forward. In particular, 3 of those tools that we initially had flagged as potentially working were not going to be able to be as transparent in terms of how the tool operated to get someone into a budget as we need for the state of Idaho, based on limitations by the developers of that tool. Based on those conversations, we then had 3 tools left to consider. It was then that we turned our attention to an in-depth assessment review process to review those 3 tools, really led by self-advocates and family advocates, and moved our way to a recommendation to the department, which is what we're here to talk about today. So I talked about this idea of criteria. I said that we had some pre-selection criteria that moved us from 47 assessments down to 6. But I want to be really clear that we all have a shared understanding of what we mean when I say criteria. A criteria is simply different qualities that something must have in order to be picked. Another way to think about this in our circumstances are that these are the must-haves for Idaho's new assessment. We're going to talk a lot about criteria today because we used a series of different criteria to narrow and identify the tool that was going to be recommended to the department. The first were the pre-selection criteria that I noted that helped us narrow from 47 tools down to 6 and then down to 3. We then used a total of 16 criteria to actually complete the selection process. Self-advocates and family advocates were responsible for reviewing 12 of those criteria. 6 were about the assessment experience, and 6 were about the content of the assessment. We also had 4 criteria that were reviewed by researchers that work for HSRI but are not on this team and actually support a different area of the organization, who have the kind of education and background in psychometric testing And so we could really be sure that the tool that was selected could meet our needs in terms of being valid and reliable based on the research that was done to develop that tool. So as I already noted, we had a set of pre-selection criteria. That was the list of states that we started with. We reviewed 47 assessments, moved them down to 6, and then through the interview and research process, narrowed it further down to only 3 assessments. We want to be sure that folks are aware of what the pre-selection criteria were. Those pre-selection criteria included that the assessment was currently being used to assess the amount of support need, that there was information about the assessment readily available, that the assessment could be used in Idaho so that there was not any kind of requirement in place that said, oh no, we won't share this assessment with another state, because that wouldn't do us very good use. That materials about the assessment could be shared publicly, because that was key to the transparency requirements of the KW settlement agreement. That the assessment has been updated in the last 25 years, because there are definitely assessments still in use today that are much older and bring with them some antiquated and sometimes offensive language in the ways that they speak about people with disabilities. That the assessment was not currently in the process of being changed, because if the assessment was currently being changed, it was really hard for us to assess if it was going to really meet the needs in Idaho moving forward. That it did collect information on daily living needs, and that it could be used for adults. So those, again, were our 8 pre-selection criteria that moved us from 47 options down to 6 and then down to 3. Now let's talk about the 6 experience criteria that self-advocates and family advocates were asked to judge or rate each of the 3 remaining tools on. The first is that people with IDD and their families helped to create the assessment. The second was that the assessment was easy to give and didn't take too much time or effort for the person who was participating. Third, that the questions were easy to understand. Fourth, that the assessment was strengths-based and focused on a need for support. Fifth, that the interview really centered on the person who was being assessed to the extent that they wanted to be involved. One complaint we often heard is that individuals were being excluded from participating in the assessment given today, and that was something we wanted to avoid moving forward. And sixth, that the assessment language is both respectful and culturally competent. Self-advocates and family advocates were also asked to review 6 different content criteria. Those criteria can really be subdivided over 3 main areas: content around daily living needs, content around medical needs, and content around behavior or mental health needs. For each of those 3 areas, we needed to be sure that the assessment covered those areas well, so really collected information about the person's daily living, medical, or behavioral needs, and had multiple ways of measuring each of those need areas. We know that people's needs can look different in different environments, or that asking information in different ways can sometimes create different kinds of responses. So we wanted assessments who really were collecting information that helped us gain a strong understanding of the support needs that an individual had in each of these areas: daily living, medical, and behavioral or mental health. As I previously noted, we also had 4 criteria that were the responsibility of researchers to review. These 4 criteria were as follows: that there was documentation of findings from the pilot study. In this case, a pilot study is simply when the people creating an assessment give that assessment to people to see if it's working the way that it should. We wanted to be sure that we had good documentation of the studies that were done to build this assessment. Second, the sample that was used in the pilot represented the larger community in Idaho, simply meaning that the people who took the assessment when it was being tested look kind of similar to the people in Idaho who would be using this assessment to determine their budgets moving forward. Third, researchers were asked to review and determine the validity of the assessment. That means how well and how accurate the assessment results were. And finally, the reliability of the assessment. Are the assessment results consistent? If I were to give an assessment today to our ASL interpreter, Debbie, and my colleague Rachel were also to give that same assessment to Debbie also on today, the results of those two assessments should be the same because Debbie is the same person, even though Rachel and I are different assessors. And that is the concept of reliability. So those were all of the different must-haves that we identified for selecting an assessment tool. So now let's dig into exactly what was the process that we used to do the in-depth review over 3 days with in person with self-advocates and family advocates using the 3 tools that were still under consideration. Before we convened with self-advocates and family advocates in Boise, we had a series of pre-meetings. We had a meeting to discuss what to expect, to understand what their task was going to be in terms of reviewing each of the assessments. We also did the first step of the review virtually because 3 days was not a lot of time to get through all of the information we needed to. And we did the first round of weighting, which we'll talk about more in a moment, virtually. The researcher criteria was also weighted and rated before we got to the on-site, and that was done virtually and facilitated by HSRI. We then turned our attention to the tool selection on-site itself. This was where we convened on October 7th, 8th, and 9th with a group of 8 self-advocates and 6 family advocates from around the state. These self-advocates and family advocates represented people from lots of different walks of life who received different kinds of services, primary English speakers as well as primary speakers of other languages, and individuals who use traditional services but also self-directed services. The on-site process consisted of completing the second round of weighting, doing a review of the 3 assessment tools still under consideration, and then rating both the 6 experience criteria and the 6 content criteria. Following the on-site, we had an additional step of doing a consultation with the Council for Deaf and Hard of Hearing to both review the 3 tools that were available, that were still under consideration, and to provide an overview of the work that had happened to date. The goal of this meeting was to ensure that we could get specific feedback on the tools that were under consideration, and that group was able to offer some specific recommendations for language adjustment across all 3 tools to make sure that it was going to also meet the needs of any program participants who were deaf or hard of hearing. So, when we're talking about the tool selection on-site, we first weighted the criteria. And what is weighting? It's simply deciding the importance of the criteria. Then we reviewed the 3 assessments under consideration. That was the Inter-I ID, the Organ Needs Assessment, or the ONA out of Oregon, and the Level of Needs Assessment, or LAWN, which was developed and is used in Connecticut, but is also used in the District of Columbia. Then self-advocate and family advocates were asked to rate each of these assessments on the 12 criteria they were responsible for. Rating is simply deciding how well each of the assessments met each of the different criteria. So, what is weighting? Weighting is just a way to understand which of the must-haves are most important in an assessment. Criteria that are given more weight are considered more important. Criteria that are given less weight are considered less important. But it's important to note that all of the criteria that we outlined earlier in this presentation remain must-haves for the assessment that Idaho selects moving forward. How did we do the weighting process? Well, the way that we completed the weighting process is that each of the self-advocate and family advocate reviewers were given 10 stars, and they got to assign the number of stars that they wanted to across the 6 different experience criteria. If they thought one criteria was the most important, then they gave it the most stars. If they thought that one of the criteria wasn't important at all, they could give it no stars. And each person was allowed to do that on their own. They completed that same task for the content criteria, but simply used eggs instead of stars and divided those across the 6 criteria. Then, when the group came together in person in Boise, everyone talked about which criteria was most important to them, which criteria wasn't particularly important to them, and why. The group was able to discuss together and have a nice conversation around what were their different reasons for why they thought certain things were more or less important. Then, following the conversation, each of the individual raters, again, these were self-advocates and family advocates, were able to complete the weighting process again. And many changed their answers a little bit based on the group's conversation. The final weights for all of the criteria are based on the average of the weighting that these reviewers gave in round 2. So here are the final weighting results for the experience criteria. The weight itself is along the right-hand side, and the label for the criteria or the description of the criteria is on the left. As you can see, when pushed all together, our self-advocate and family advocate raters and reviewers felt that the language of the assessment being respectful and culturally competent and the questions being easy to understand were the most important of the criteria. The assessment being strengths-based and focusing on the need for support came in next, followed by that people with IDD and their families helped to create the assessment. The interview centering on the person being assessed as much as they want to be involved was seen as slightly less important, but again, still an important criteria. And the assessment being easy to give and not taking too much time was given the lowest weight across these 6 criteria. In conversation with the raters, what they identified is while it is important that the assessment doesn't take too long, it's better for it to take as long as it needs to take to get the right information and it be accurate and correct about the person's needs. Next, let's look at the weighting results for the content criteria. Again, these were the 6 criteria that our self-advocate and family advocates were asked to review that talked about how well the assessment covered daily living, medical, and behavioral support needs. Across these groups, our raters really felt that the areas of behavior and medical need being well covered were the most important criteria, followed closely by having multiple measures of behavior support need and multiple measures of medical support need. Also of great importance was having well covered and multiple measures of daily living need. But our reviewers identified that having lots of different ways to measure medical and behavior need was of utmost importance because people's needs can vary so much in those areas and really have a major impact on how much support they may need day to day. And finally, here are the weighting results from our researcher criteria. Again, these are the weights that were given by our researchers. They felt that the validity and the reliability of the tool was most important, followed by the sample that was used in the pilot, looking like the population of Idaho, and that having clear documentation from the pilot study was the least important, but again, still a must-have and still important. So now let's talk about rating. So what exactly is rating? Rating is simply deciding how strong an assessment is in a given area. How do we go through rating for this process? Well, each individual rater, so self-advocate and family advocate, had a scorecard that looked very much like this. And for each of the different criteria, they identified whether each of the three tools under consideration did poor on this criterion, did okay, or did great. Each of the individual reviewers first completed this form on their own. Then they met with their small group and all agreed on the rating to give each tool on each of the criteria. Finally, the ratings for these three groups were all combined to get us to a final score. So that's how we got here. Now let's bring it all together. Here are the final ratings for the experience criteria. This is based on both the rating, but also the weighting that was completed. The lawn received the highest score of 23.7 on the experience criteria, followed closely behind by the organ needs assessment with a score of 22.7, and coming in third was the inner eye ID with a score of 11.9. The content criteria, again, the information that's collected by the assessment, again here, the lawn came in on top with a score of 27.7. ONA, again, not too far behind with a score of 22.8. And finally, the inner eye ID with a score of 17.4. For our researcher criteria, the inner eye came on top with a score of 28, followed by the lawn, the score of 24.5, and finally the ONA with a score of 24. When you put that all together, here are the final ratings, weighted and averaged across all of the different criteria. The lawn's final rating was 365.5, the ONA 344.3, and the inner eye 291.4. This means that the final recommendation coming out of the assessment selection process that is being submitted to the Department of Health and Welfare is to use the level of needs assessment developed by the state of Connecticut and currently in use in both Connecticut and Washington, D.C., moving forward for the adult DD program. I'm going to pause here and see if folks have any specific questions or thoughts about what we've covered so far before we turn our attention to next steps. Folks can feel free to raise their hand. You can do that using the React button. It's a little heart on the bottom of your screen and then a raise hand option. You can also put any questions you have in the chat. I see a question in the chat asking what the assessment process for the lawn will look like. That's a very good question. So the lawn assessment is available publicly, and once one of the next steps is completed, which is getting the official approval from Connecticut to use the lawn, we will make that instrument available for folks to review. It is a interview style assessment that asks questions specifically about people's needs, both in the community and at home, in a variety of different areas. I also see a question here about is the ONA being kept in the sidelines just in case? That's a great question. And yes, so as we'll talk about next steps in just a moment, there is the potential that we may need to go to the second choice. And if so, we have all of the results of this process to explain and justify why the ONA does also meet our requirements for Idaho and can be used if for some reason the lawn could not be used moving forward. Other questions before we move forward? Okay, I'm going to move us to the next slide then, which is around next steps. So, a group of self advocates and family advocates were able to lead the process of getting to a final recommendation. They were supported by the team at HSRI through facilitating that process and by a team of HSRI researchers who also weighted and rated a couple of the criteria that were really focused on the psychometric properties. What happens next is that my team at HSRI is in the process of writing up a report that explains the full selection process in a lot more detail than what we're able to cover in just this webinar today. We will also be creating a plain language summary to make sure that that information is as optimally accessible as possible. Next, the department will need to contact Connecticut to officially get the right to use the tool and to request to make some minor changes. The kinds of changes that are being requested are things like very state-specific language, so the use of the term case manager versus service coordinator, or some language changes that were recommended by the Council on Deaf and Hard of Hearing in their review of the tools. The department has already been in conversation with the state of Connecticut, and they knew that their tool was in final contention. So we do not foresee any issue with getting that official right to use the tool, but note that it is an important next step. The department will then need to begin the process of drafting a request for information and a request for proposal for the new assessment contractor. The state has been waiting for a decision or a recommendation around this tool before going forward with the process of identifying a new assessment contractor because they are required to put that out for bid on a certain time interval. This will be happening over the next few months, and information about the tool that was selected will be included in the request for information and the request for proposal to make sure that whoever is selected as the new assessment contractor is able to meet the needs and the expectations around completing the lawn for purposes of determining budgets moving forward in Idaho. The other next step that we want to talk about today is the department collecting additional feedback about what is important to you about the assessment process. In particular, we'd like to start that next step right here today with all of you on the line. So what we have heard so far about the importance of the assessment process has been varied, but here are a couple high points. We've heard that it is absolutely essential that a Spanish version of the assessment is available so that any Spanish speakers who use the program can understand the information and read the assessment themselves. We also have heard that it is essential that plain language information about the assessment is sent ahead of time so people know what to expect during the assessment process. We also have heard that the assessment results should be received automatically by individuals and that information should be offered in plain language to make sure that people don't have to do a lot of runaround to find out the results of their assessment. We've also heard that the person being assessed needs to be the person who decides who the respondents are who are giving information about their support needs. So these are just a couple of the things we've heard from family and self-advocates about what are must-haves when it comes to the process of getting an assessment. So I'd like to open it up to folks on the line to give additional feedback about what else is essential, a must-have about the process of getting the assessment itself. I see that it is available in the person's native language. And please feel free to come off mute to give feedback verbally or to put things in chat um, with anything that you feel like is very important as you are participating in an assessment. I see a couple of comments around the length of time being a concern. Um, Based on our research and our conversations with the state of Connecticut and Washington, D.C., this assessment takes about 1 hour to complete.
What about mental health?
Are there questions about mental health on the
Yeah,
assessment?
yes, because my boys aren't the same. Neither one of them are. One's a little worse than the other one, and their moods change from day to day.
Yes, so this assessment does include questions around mental health and behavioral health needs and asks the kinds of support someone needs both at home but also in the community, because we know that people's needs in those areas can be different based on location. Okay, I see some additional comments saying that they want level of care to be the top consideration, not whom they choose to hire or live with. Um, I see some feedback about wanting there only to be a need for one respondent, not multiple respondents.
I have a question.
Please go ahead.
Okay, so I'm a plan developer. I do self-direct and traditional. I'm just wondering the timeline for this, where it seems like lately Liberty's doing their assessments like basically right when I'm supposed to be submitting a plan to the department or right after. And I'm just wondering the timeline. So there's enough time to have plan developers gather the information necessary for plans to submit in a timely manner to the department so they have time to review the plans. Do you know what I'm asking? Like I'm
I
jumbled.
I think that's a very clear question. Wanting to make sure that someone receives the assessment far enough in advance that the results of the assessment can be utilized and as a part of the planning process, but also so you have an idea of what the budget is as you're doing the planning process before that plan needs to be submitted.
Right, right. Because right now I'm supposed to have submitted a bunch of plans in December and they haven't even done the assessment for Liberty. So I'm submitting a bunch of late plans.
Got it. I think that that is a concern that we have heard, and definitely thinking about and coordinating the timing of when assessments are conducted so that they're not late, so they don't limit people's ability to get their plans developed, is a piece of what is being considered and what will be a part of the expectations and will be put into the contract for the new assessment provider as we're moving forward to kind of address exactly that issue.
Perfect. Because sometimes it gets hard when like you plan on submitting, 5 plans, say the beginning of December, but then they get pushed back and you already got 7 plans at the end of December. So now you're doing 11 instead of what you originally should have. So it can get chaotic when Liberty's late.
Understood. Thank you for that feedback. That's very
Thank
helpful
you.
to know.
Appreciate it.
I also see a comment needing it to be taken into consideration that some individuals, for this person, their child, is not able to answer questions verbally or may not be able to make decisions about who should answer questions, noting that that can be difficult to advocate on their loved one's behalf. So thank you for that feedback. We definitely want to make sure that wherever possible, the person is given the right to answer the questions, that their opinion of their needs is the focal point, but understanding that some people may not be able to do that or may not choose to do that. And so ensuring that accurate information is collected through a variety of means will be very important. I also see a question here just asking if we anticipate caregiver pay being decreased. To my knowledge, there is no specific elements of decreasing caregiver pay associated with this change. Although there may be some other elements involved that I cannot speak to as an outside contractor, so I apologize. And I see a question here about will there be options to skip sections that will not change and not have it focus on their losses every year? We've heard a lot of feedback and a lot of frustration from folks that they have to do an assessment year after year after year, but sometimes needs aren't changing. The need for an annual assessment of support need for the purposes of determining if people are eligible is a requirement from the federal government. So there is a need to do that annual assessment to ensure that someone still meets the requirements to obtain these services and supports. And we also absolutely hear the feedback that sometimes that can feel overly burdensome from individuals. The new budget tool will go in, the specific date that the new budget tool will go into effect is still being finalized. The department is working very diligently on pulling together a final timeline for this entire implementation process, and we'll be making that publicly available as soon as it is finalized. The number of respondents that are required for this assessment is something that is still being determined. So it will be dependent on a conversation with Connecticut around what their expectations are because they are the owners of the tool, but also can be informed by feedback from individuals such as yourself. And the expectation now is that the lawn would be completed annually, with the opportunity to complete it more often if there was a major change in need. But again, that is a preliminary decision at this point. I'm going to move us to the next slide because we have some additional things that we've been hearing around what folks want from the assessment process. So the last slide was about some things that people said were essential. These must be a part of the assessment process. We've also heard some thoughts from individuals, families, and others around what would be nice to have in the assessment process. Things such as having not just someone who is able to speak your native language, but somebody who is a native speaker in your language. So having a native Spanish speaker assessor, or not just having an interpreter available, but actually having someone who is fluent in the language there face to face with the individual. We also have heard that folks would really prefer having some familiarity with assessors. So someone who's known the person, maybe that could even just limit like the same assessor year after year. We also have heard that wanting to have service coordinators and support brokers participate in the assessment process, even if only to be able to observe and listen so that information can be incorporated into the planning process would be a nice to have. And that folks really want there to be a flexible process where folks can take breaks during the assessment if they need to, that the person gets to decide if it is either virtual or in person based on what works best for them. Again, these are some things that we have heard so far about what people want from the assessment process. And we'd love your thoughts on additional things that you would like to see be a part of the assessment process. We've already gotten some in the chat and would welcome folks to continue adding more as we move forward. I've seen a couple of questions with regard to whether there are CEUs for this meeting today or if this is a required training for certified family home providers. I am not able to answer that. If someone from the department is on and can, please feel free to come off mute. I will note that we will be doing regular updates on the KW, called KW updates about where we are in the development process. So folks can be aware of how we're progressing towards moving to a new tool. And this will be something that we'll be doing on an ongoing basis. So you guys can continue getting updates as we move through the process.
Alina, I can speak to the CEU question.
Great. Thank you, Eric.
Yep. Hi, everybody. I'm Eric Brown. I'm the Bureau Chief for the Bureau of Developmental Disabilities at the Department of Health and Welfare. So we are not able to offer CEUs as this is an informational meeting versus a educational meeting or a training meeting. I understand you're getting new information, but so it is considered informational. So we don't have the ability to offer CEUs.
Thank you for that clarification, Eric. I see some folks agreeing that doing the assessment virtually is a good option. I also see that wanting to make sure that advocates are a part of the process so the person understands and is listened to is and also something that folks would like to see in the process. And I do see a question that asks about if this new tool um, could potentially result in someone getting a budget less than what they are receiving today. Um, that is a question that I think is a very reasonable one. And the short answer is it is possible, but there are a lot of additional steps that come before we get to that part of the process. So, right now, where we are is simply having identified a new tool to help understand support need. What will come next in the process is actually completing some of those assessments, um, with people in the state of Idaho, so conducting our own pilot study to actually develop the new budget framework and the new budgets that will be working moving forward. There will be lots and lots of opportunity for engagement, for communication, and for your input as we work through this process over the next few years. So while yes, there is a possibility that with a new assessment tool and a new way of doing things, an individual person could see that their budget be lower than what they're receiving today. The goal of this initiative is not to reduce budgets. The goal of this initiative is to have a clear and transparent way to understand support need and to assign budgets in a way that is meets the requirements of due process, that people understand exactly how their budgets came to be what they were, and can then have exercise their rights in any way necessary to ensure that they're able to get what they need. Let's see. I also see more comments noting that virtual options are positive. I see a question asking around inter-rater reliability process for assessors with the lawn. The training expectations around the lawn are something that we'll have further conversation with Connecticut about, and that the state of Idaho will also have a great opportunity to build into the expectations for the new assessment contractor. So if you feel like having an inter-rater reliability training process for assessors is a key thing, let us know that. And that's something that can be included and put in as a part of the request for proposal when the department is getting proposals for who the new contractor will be to complete assessments. So there is not a firm deadline for the SIB-R to be replaced. We are continuing to move as quickly as possible, but there are quite a few steps along the process to get down the path until we are fully in implementation of this new tool and the entire process has been designed with your input and feedback. Individuals will continue having access to their KW budgets as they do today, and we will work closely alongside all of you in the development process as we move to this new tool that we hope is going to be informed with the assessment of the lawn based on all of the hard work that was put in by a number of family advocates, self-advocates through this selection process. I see that folks really identifying that reliability and consistency within the assessors is going to be very important. Um, so that is definitely will be key elements of what we'll want to incorporate in the expectations for the assessment contractor. And I see a question here asking if Liberty will still be the contracted assessors. Um, Once there is a new assessment contract or a new request for proposal put out, anybody can apply to get that contract. So Liberty can apply, others can apply. So we will not know who will be the new contractor following the request for proposal process. That will have to go through that entire process, and then we will know who will be doing assessments in the future. And I'll just note for folks that There is a comment in the chat from Sarah S. at the department. Thank you for putting this in here. There is information on the lawn that is actually available on Connecticut's website. And so a link to that website it is in the chat for people who would like to take a look and get a little more acquainted with that tool. So that is the end of our dedicated presentation for today. I'm going to stop sharing my screen so we can look at each other's faces. We absolutely still have time for more questions, for more feedback, additional thoughts about what's important to you, about the process of getting the assessment, really making sure that we have the requirements for the assessment provider that we can put those in the request for proposal are going to be really key in making sure that the assessment process feels the way that you want it to feel as a person walking through that assessment. So any additional thoughts or feedback on that are greatly appreciated. I see a question here asking about how you get on the Family Advocate Board. I'm not sure if that's something that someone from the department is able to answer. I do not have that answer, unfortunately, Diana. All right. Well, again, I'm not seeing more questions come through. You are welcome to take yourself off mute and give any questions or comments verbally. Also, welcome to put that in the chat. I see that wanting to make sure that behavior is included in our understanding of support need is going to be important. I also see a comment that the assessment should consider the physician's opinions with regard to people's needs. Well, again, I want to thank each and every one of you for spending your lunch hour with us today to get this update. We look forward to seeing you in the new year and often as we continue to work through this process alongside the department and help move to a new budget tool for the state of Idaho.
And we just got to make sure that the legislature keeps up with it and is willing to give us the money.
Thank you again. If you have questions or concerns, you're always welcome to get into contact with the department. And again, there will be many more opportunities for feedback. This session has been recorded. The slides will be made available on the department website or on the My Choice Matters site, but it may take a few days for that to get through the approval process to be uploaded. So please be patient, but also let folks know that this material is available if others are interested in an update on where we're going next in the tool selection process and obtaining a new budget tool. Thank you all and have a great rest of your day.